I'm Dr. Josh, I'm a chiropractor, and I'm the founder of Highlands Wellness and Sports Injury Clinic. In this video, I'm going to show you some of the things we do when a patient comes in with one of the most common injuries we see here, which is a shoulder injury. I treat a lot of athletes, whether it's rowers, weightlifters, golfers, and shoulder injuries are fairly universal. That doesn't mean everyone's going to get them, but we do see them across a broad spectrum of sports. So, the first thing we want to do with most shoulder injuries is make sure that it's not a fracture, make sure that the joint's not been dislocated, make sure there's no things that are going to require either additional imaging, surgery, something like that. We rule all of that out. Most people don't have those things, which is great. It means we can treat them. We want to make sure the pain is tolerable, and there's lots of things we can do with that, whether it's, treating with some hands-on care, some soft tissue release, acupuncture, adjusting the nearby joints just to get everything moving, feeling a little bit better. But I do find that for most shoulder injuries, ultimately, we got to get them strong and we got to get them mobile again. Otherwise, the return to sport isn't going to go very smoothly. I'm going to quickly demonstrate one of my favorite exercises to start building mobility in the upper back and in the rotator cuff and shoulder. A lot of patients find that they're lacking some external rotation. They can't engage their upper back muscles anymore, especially after a shoulder injury. This is going to help with neck, upper back, and shoulder mobility, as well as opening up the chest and starting to get those muscles working. It's really simple, doesn't require any equipment, but it is a lot more challenging than it looks, so take it slow. At the end of this demonstration, I'll show you a slightly easier version you can use as well to build up to this if you need to. With all rehab, there should be ways to progress it, but also to regress it if what we're doing is too challenging or exacerbating symptoms. This shouldn't hurt, okay? But let's start. Will be head, shoulders, elbows, hands, and all 10 fingers up against the wall. If you have a watch or like a big ring on right now, not a bad time to take it off because I don't want you to scratch your stuff up. So, shoulders, head, elbows, all 10 fingers. And if you can, even try and do wrists, but that's really challenging. You can let your bum drift away from the wall. It'll make it easier. And then from here, you're going to simply drive your arms up and then come back down. Up and then back down. Trying to keep that pressure of all those different areas against the wall the whole time. You can go out to the side and then come back in. Out to the side, back in, and then you can come up and try and touch hands. Those variations are just going to slightly challenge the muscles differently, but they're all excellent. If that's way too hard, and for a lot of patients at the beginning it will be too hard, we can flip around, do a very similar drill, except now we'll be facing the wall. You don't have to have your head against the wall for this one. I'll demonstrate that right now, and it's a good way to build up the same areas, the same muscles, work our way toward the full wall angel position. So it looks like this. Hands and elbows against the wall, and then reach. You're going to notice it's going to have a lot of the same benefits as the full wall angel. In our assessment for patients who come in with shoulder pain and upper back pain, I often check external rotation and internal rotation. Frequently, I see a lot of patients struggle with one or maybe the other, sometimes both, but often it's one or the other. And then I prescribe drills accordingly. All you need to do this is lay on your side. You can use a pillow to support your head. It'll be a bit more comfortable. Get that elbow and shoulder tucked down and then push the elbow down into the surface that you're laying on top of. And now from here, we can rotate out and we can rotate in. When we rotate out, we can start to build some strength at these different positions, right? I can be out here, I can be here, here. I can build strength at those positions by using my other arm to provide resistance. So I'm going to come out close to my end range, but it's not painful, and then put my hand here, and now I'm going to try and push into it, okay? But I'm not going to let myself. And then I'll push, 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 hold for 3 seconds, and then relax everything, and usually I'll find that my range of motion has improved a little bit, but also I know I'm building strength in this position. So push, 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 3 seconds, and then relax, okay? We can also provide resistance the other way. So it's like two sides of the same coin. We want to strengthen the muscles that bring us this way, and we want to strengthen the muscles that are going to bring us that way. So I put my arm behind, and then I push. I'm not pushing this way. Push, 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 same thing, 3 seconds, and then relax. So that's how I would train both sides for external rotation. And then internal rotation going this way. I'm not as good at this one, but again, not painful here. Internal rotation, I would come to a point where it's still comfortable, but I know if I go any further, I might start getting pain. And then I can do the exact same resistance that I did for external rotation. So I'll be here, and then I'll fight myself here, and I'm trying to push this way. So pushing, 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 3 seconds, and then relax. Come a little bit further, pushing, 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 3 seconds, and then relax. When you do this, just try your best to keep that shoulder down and tucked, and try and keep the elbow pushed down against the object you're working on. If you get more internal rotation by simply just like, you know, moving the shoulder around, you're kind of cheating the point of that drill. I like the wall angel, and I like this, it's called a sleeper stretch when you're lying on your side there. Both are great for mobility and starting to put the foundation down to build some strength back into the shoulder. Frequently, patients will progress from these to more heavily loaded exercises later in the rehab and more dynamic exercises in the rehab, because life and sport are generally a lot more dynamic than, you know, lying on your side and doing some stretches. However, there's steps to this. Like any good rehab program, we want to take you from where you're at and build you up to what your goal is. Get you back to what you want to be doing, even if it is as simple as reaching into the backseat to grab a purse, or maybe it's trying to set a new Canadian record in the discus. Both are great goals, and we're happy to help with either one. Let me know if you have questions, leave a comment, or get in touch with the clinic.